morning's Health Watch, a summer survival guide. More than 2/3 of Americans have had some type of medical emergency in the summer, anything from an insect bite to life-threatening heat stroke. So we want to help you hopefully avoid all those things, but deal with them if they do come your way. Our Dr. Jennifer Ashton is here this morning with tips on keeping safe and healthy from now until September, or maybe if we're lucky, October.
Or longer.
So the first thing that we're going to talk about this morning is surviving the heat, because
Exactly.
it can be so intense it can really do damage on you. What are the most important things to do?
You know, Erica, people get affected by heat stroke when they least expect it because, again, you're outside, you're having fun, you're being active, you are sweating, and you can get dehydrated very quickly. We hear all the time that people who are susceptible, the very young, very old, pregnant women, people on certain medications or with chronic medical conditions, and really the key is hydration. You want to keep yourself well hydrated, and that needs to start before you go outside.
Right.
When you are outside, you really want to drink about every 15 to 20 minutes.
Wow.
Water is best, okay? But you really want to make sure that you keep yourself well hydrated when you're outside. Obviously, you want to avoid beverages that contain alcohol, caffeine, sugary beverages. They can actually dehydrate you more. And you want to avoid very, very, very icy cold beverages, only because they can give you a little stomach cramp. They can't actually make you sick, but they can make you feel
But
not
just
so
avoid
great.
that. Okay, so all good tips on how to do that. If you are worried, though, that someone you're with, even if they've done all these things, is really not doing well, what are some signs we should look for heat stroke?
Well, first of all, when your core temperature gets above 103 degrees Fahrenheit, that is a medical emergency. So you really want to act quickly and take action. Other things that you can look for: if their skin looks red, hot, dry, they're not sweating. When you lose the ability to sweat, that's a key sign that you're suffering from heat stroke. Your heart rate can be rapid. We call that tachycardia. So your pulse might be racing, your heart might be pounding in your chest, and something that you might feel, headache, dizziness, nausea, that's a sign that your core temperature is really too high.
And those are some close signs to dehydration, too. So could dehydration really be a sign that heat stroke is next in the summertime?
They tend to go hand in hand.
Okay.
So again, even something like sunstroke, which is, goes hand in hand with heat stroke, you can get a very bad sunburn. It can cause your core temperature to go up, and then you can start to manifest these signs.
And speaking of sunburns, perfect segue there.
Exactly.
If you do get one, what is the best way to treat it?
Okay, a couple of things. You want to treat it topically, so things even like cool packs, aloe, even in some cases, in some areas, limited use of something like a hydrocortisone cream can help with the inflammation. Then you want to treat it systemically, so something that you take like an Advil or Motrin really helps with the inflammation.
Anti-inflammatory.
Exactly. Tylenol will not work, and you don't want to give babies or even teenagers aspirin, but those things like Advil, Motrin, ibuprofen can be really, really helpful.
Okay, and then also, my poor mother is like a magnet for poison ivy.
Right.
You say it's really important to learn your leaves.
Yeah, so we say that those of us who live out in the suburbs, leaves of 3, let it be. If you're going camping, hiking, look around before you go plunging through the woods or grass, because they typically can have some red tinge to them. They contain an oil that's very contagious and creates this massive itching effect. So way you treat it, you want to get that oil off you with a detergent or alcohol. Obviously, those do not go in the eye. If you think you have poison ivy or sumac in your eye, you really want to see a doctor. But you want to get that off as quickly as possible, and then again treat it with like an anti-itch, like a Benadryl.
Or like a calamine lotion, does that work too?
That can be helpful too, yeah.
What about bee stings?
All right, now bee stings.
The worst.
If you think you might have a serious allergy to a bee sting, that might be someone that you might want to talk to a doctor about getting an EpiPen, because it can create an anaphylactic reaction. For all other people, you want to get that stinger out of the skin as quickly as possible, because it releases a venom, and the best way to do that is to scrape with a credit card.
So when you say scrape, I just wanted to, so it's actually, am I sort of pushing it like this, like pushing it out, get behind it?
You don't want to use a tweezer. You want to scrape it along your skin and then apply ice or, again, an anti-inflammatory.
Because we don't want to release any more of the venom. That's why they're
Exactly.
What about the old baking soda?
Yeah, that works
Does that work?
too. Yep, any of those are good.
My grandmother did that for me. I want to make sure.
And learn CPR. That's the most important thing.
You say that's the best thing we can do this
Absolutely.
summer. So that's your summer homework, is to learn CPR.
Yep.
Jen, thanks. Have a great holiday weekend.
You too, Erica.
A lot happens early on The Early Show, weekday mornings on CBS.